Hello, I'm Mehar. I'm physiotherapist at PRS Neurosciences, neurorehab. So today I'm going to talk about our patient Balchand Gandhi. He's a 77-year-old male patient. He was admitted here on 27th February. We can say with a very low GCS and in a field level of 1. He was not awake, he was not in a proper state, and he was admitted in the ICU. Actually, his problem was he was in his hometown in Rajasthan, and he had a left thalamic bleed and continued with IVH and all that, and he was in a bad shape, and he came here and got admitted in the ICU. So initially when he got admitted, his GCS was very low, very poor, and eye opening, he was not opening consistently. There was no spontaneous eye opening. He was hearing, he was obeying commands, but he could not respond properly. He was very weak, and medically also there were many comorbidities associated with him. He is already a heart patient also, and he got in between he got dialysis done because of his kidney failures. So altogether in the medically also he was very low. His body was very weak, and the rehab started right from the ICU. Respiratory therapist was seeing him, physiotherapy was happening, like constantly we were keeping his body future ready, and there was exercises associated, there were chest physios done proper, and it was like we were taking care of him from the ICU. And he was in the ICU for more than a month because of his medical situation, where he was not able to come out of it so easily. And after he getting into the ward, into his room, he was he was getting more better, and day by day there was some improvement seen. First of all, in between in the ICU itself, he was having a GCS dip also, so we were worried about all that. But later on he picked up. GCS got like E4, V was tracheostomy was there, and M6. So we were doing our maximum to get him to that function, to the functional level which we expected. And later on he started giving us smile. He tried to communicate. He was not able to talk because of the tracheostomy tube, but still he was trying to communicate with actions and all that. But later on during therapy, we find out that he has some tremors. He is having some movement disorder kind of symptoms. Some Parkinson features were coming up in between. So we escalated it to the medical team, and they have taken care of it, and we have got that also settled down. So it was easy for our rehab team to do our rehab to the best, because it was taken care of. And he had a tracheostomy tube that and had a rice tube for the feed also. He had very bad oral pooling, so MPSS was done and find out that the oral pooling is still there, but his aspiration, the aspiration was clinically not there, but there was oral pooling, lot of pooling and all that. Our therapists, they taught him exercises, they taught him how to have food properly, how to avoid the pooling and all that, and that helped him a lot. Then later on they removed the rice tube. By the time, if coming to the physical therapy part, he was able to roll in the bed, he was able to move all 4 limbs. There was minor weakness in the limbs, upper limb and lower limb, but it was still he was able to do it. He was able to move all his limbs. And meanwhile, because of the tremors and all that, that was also medically taken care of, so he was getting better day by day. After some time, the rice tube was removed. He was able to take orally all the food, and even his medicines also he was able to take it orally. And later on, tracheostomy tube was also removed, so he's out of all the tubes now. The rice tube is out, the tracheostomy tube was out, and he was having bladder control also. In between, that was also happening, so his bladder control was fine, so they removed the urine catheter also. Then by the time the physical part also, he was improving every day. So the he sitting in the bedside, we increased the time he is sitting in the bedside. Then we shifted him to the chair, and we thought the patient party also, if the rehab team is all not around also, they can make him sit. We taught them how to make him sit, how it is done, how to make him roll to the side, get up to sit. So we taught them also it, so they can also do it in our absence. And they were shifting him to the chair. He was sitting in the chair for a long time. He was moving around the wheelchair. He even started reading newspaper. So all that, he was coming back, and he had age related or arthritic issues, and he have knee pain also. So walking was little difficult initially, but later on he was able to stand up. He was able to stand up himself, take steps very minimally in the parallel bar. Now that also has improved. We have find a solution for the pain also, and with the knee supports. So he is getting better. We can see him getting better every day. Now when we go and talk to him, when he will ask us. Before we were struggling to get anything from him. Like we were asking him continuously, sir, what you have, how are you, and all that. Now he ask question, how are you, what you had, and all that. So that is very happy moments for us to see him recovering so nicely. So currently he is in a stage where we can discharge him out of the hospital. He don't need any medical support as such. He is able to with one person support, he is able to stand, and we can even shift him to the chair. Still he need more rehab, but currently he is out of the hospital setup. His all tubes are out. Mehar bolo. Mehar bolo. So we are still working on him to get into the full recovery, but he's in a stage he can go out of the hospital and come on a daily basis in our setup, so he can continue the rehab. So we are very happy with the recovery what he have gone through.
Hi, I am Jitendra Gandhi, and my father Balchand Gandhi had a stroke apparently in the month of Jan, and he was hospitalized in Rajasthan, Udaipur. He was there for a period of close to 30 days, and then we had to move him to Bangalore, here at Mehar Jain Hospital on February 26th. Post that, he's been under the care on guidance of Dr. Sharan and his team, and we are highly satisfied and grateful to the neuro rehab team who've taken immense care and helped in our father's recovery. Everyone whom I have actually interacted, be it Dr. Sharan, be it Dr. Pratibha ma'am, be it Dr. Shashidhar, and in the neuro rehab, Mr. Neil, Ms. Mehar, Ms. Harsha Raj. I may miss a few names, but I've been really thankful to them. Very, very, very transparent, okay, and have guided us well. Thanks to every one of them, including the housekeeping, because that's something what everyone misses out in stating. They have also been really, really, really good.
How did you choose us? Like, how did you get to know about it?
Okay, in terms of PRS Neurosciences, my brother himself is a doctor, so he had a word with Dr. Dwarka, who happens to be the HOD at NIMHANS, and he had suggested, like, as a part of better recovery for my dad, it is advised that he undergoes rehab. That's where he had suggested Dr. Sharan, because he also happens to know him quite well, and that's how we chose for this.
And what did you like the most about the service here, sir? Like, what was the feature that you liked the most?
See, the feature what I liked most is because I had observed that sense of comfort that generally comes when we are able to connect with the patient in the language in which he's most comfortable. And I did realize that, if and whenever my dad was not comfortable, and if we were to pitch in with our language, okay, if we wouldn't find the neuro rehab getting agitated and things like that, because we generally find people tend to get upset or agitated with that aspect. They term that more as an interference, which was not to be seen here.
You were to recommend PRS Neuroscience to somebody else, why would you do that? Like, what is the reason you would do that?
See, in terms of understanding the aspect of neuroscience, okay, whenever there is anyone who's had a stroke, okay, there are a lot of generic notions what people have. So every stroke will be different and every treatment will vary. So in case if there is someone who's apparently had their close to ones having a stroke, I would advise them not to go with notions, okay, because everything will have a scientific approach. And here in a rehab, they would know exactly what can be done. Even at the interaction which we had at the initial stage, if I was not wrong, it was Mithun who had done the interaction. Mithun did not set any rosy pictures. He was pretty clear stating that as on today, my dad is at this position. So we expect him to be after a 28-day neuro rehab at X levels, and the optimum level what we desire could take 6 to 9 months, which makes a person understand that let's be realistic. And that is one thing which I appreciate, because because I want to promote myself, I should not say I'll do wonders in 28 days when it may not be possible. Something which is more worse than a promise, a false promise, is a false hope, because a false hope leads to a lot of other things which even a promise may not be able to.
Anything else you would like to add, sir?
Nothing, just that they've been really good. Thanks a lot. Keep continuing the good work. Appreciate it.